Medical doctors are people that are known to have trained and qualified to diagnose and treat people that are ill. And to do that more effectively, most doctors specialize in a branch of medicine, which we're all going to learn in today's video. We usually carry out this function in the hospital. A good hospital has all the equipment and manpower necessary to deliver the best healthcare services to patients. We also work with other health workers to ensure that is possible. It is important to note that not all doctors are directly involved in treating patients. Yes, you heard me right. And it's also important to note that not all doctors work in the hospital. Yes, you heard me right again. But that's not what we're concerned about in today's video. That will be a video for another day. Today we're looking at the various specialties of doctors that work in the hospital to treat patients. So let's just start. Doctors that treat patients in the hospital are broadly divided into physicians and surgeons. The physicians do so by using medications, whereas the surgeons perform surgeries or operations on patients. We'll be looking at the specialties based largely on the organ or parts of the human body that the specialist is focused on. Some specialists are also focused on the type of people that they treat. I'll make this video as simple as possible because I'm aware that quite a lot of you watching today's video are not health workers. Starting with diseases of the brain, the physicians concerned are known as neurologists and their surgical counterparts are known as neurosurgeons. There are also a group of physicians that are concerned with the brain but now focused on mental illnesses and they are known as psychiatrists. The next group of doctors specialize on diseases of the human heart. Here the physicians are known as cardiologists and their surgical counterparts are known as cardiothoracic surgeons. To be fair, the cardiothoracic surgeons don't just focus on the heart, but also on the lungs, which are also located in the thorax or the chest. But their physicians are focused on diseases of the lungs, and they are known as pulmonologists. For diseases involving the digestive system, the physicians are known as gastroenterologists, and the surgeons are gastrointestinal surgeons. For diseases of the urinary system, the physicians that specialize in that are known as nephrologists and the surgeons are known as urologists. Now, there are doctors that are trained to handle diseases affecting almost all the body parts, but let's say at the peripheral level. The physicians are known as family physicians, and in some countries the general practitioners do this work also, whereas their surgical counterparts are known as general surgeons. For general surgeons it's not that simple, but for the sake of this video let's just leave it at that. The next are diseases of hormones produced in the body. The system involved in this is known as the endocrine system. Diabetes is one of the diseases handled here. So the physicians are known as endocrinologists and the surgeons are endocrine surgeons. Let's move to doctors that specialize based on the peculiarities of the people they see. For children, the physicians are known as pediatricians and the surgeons are known as pediatric surgeons. As for doctors that focus on women, they are known as obstetricians and gynecologists. Obstetrics has to do with pregnancy and gynecology has to do with diseases of the female reproductive organs. The next are doctors that treat diseases among elderly people. The physicians are known as geriatricians. They have no surgical counterparts. And the same goes for doctors that deal with athletes. They are only physicians and they are known as sports medicine physicians or sports medicine doctors. As for doctors that deal with obese patients, the physicians are known as bariatricians. Gastrointestinal surgeons usually carry out bariatric surgeries. At this point, it's important to note that there are some specialties that are purely for physicians and some specialties are purely for surgeons. So starting with specialties purely for physicians, the doctors that treat diseases involving the skin are known as dermatologists. The next set of specialists are known as the rheumatologists, who are not only concerned with diseases of inflammation in the body, but also autoimmune diseases and diseases of the musculoskeletal system. Think of arthritis or rheumatoid arthritis. These are the experts. The next set of doctors handle diseases that involve allergic conditions, which has to do with the immune system, and they are known as immunologists. Medical geneticists focus on hereditary or genetic illnesses. The next physicians are specialists concerned with medical emergencies, and they are known as emergency medical physicians. Although there are surgical emergencies which usually involve trauma, the surgeons that specialize in this are known as trauma surgeons. This leads us to specialties that are purely reserved for surgeons. And we start with the eye. The specialists are known as ophthalmologists. The next are ENT surgeons, who deal with diseases involving the ear, the nose, and the throat. That's where we get the ENT from. They are also known as otorhinolaryngologists. Oto refers to the ear, rhino the nose, and laryngo refers to the throat. So joining them gives you that long name that can intimidate you. It just simply means ear, nose, and throat specialists. The anesthesiologists are involved with anesthesia, and the orthopedic surgeons concern themselves with the bones. These guys work like carpenters. Oncologists handle cancer cases. The next are arguably the most popular amongst doctors. They are known as the plastic surgeons. Am I wrong? They handle cosmesis, which means they beautify unsightly body parts caused by diseases or trauma. Their functions now go beyond this. I don't need to explain now. This leads us to the maxillofacial surgeons, who are known as the plastic surgeons of the face. Maxilla is the name for the upper jaw. Then the last group of surgeons are the vascular surgeons. They focus on diseases of the blood vessels, which are the arteries, veins, and capillaries. On this note, I can now say that that's all for today's video. And though this video covered a lot of specialties and subspecialties, I can tell you that there are actually more than we covered here. But these are enough to give you an idea of who is who in medical practice, save for those that don't work in the hospital. I hope you learned something, and I hope you also enjoyed it. If you did, please give this video a like and share this video with as many people as possible. If you're yet to subscribe, please subscribe and turn on the bell notification. Thank you, and I'm going to see you in my next video. Bye.